As a physician, one of the complaints I hear most often from older adults is persistent phlegm, that thick, uncomfortable sensation deep in the throat that forces you to clear it again and again, interrupts your sentences, makes speaking uncomfortable, and often leaves you feeling self-conscious around others. And the most frustrating part is that no matter what you do, it seems like it simply won't go away. You may notice that when you wake up, you need to clear your throat several times before you can even start your day. It feels as if even when you cough, there is something stuck there that won't move. You may have tried syrups, lozenges, herbal teas, home remedies, and when there is some relief, it lasts only a short time. Many patients arrive at my office already exhausted, convinced that this is just a normal part of aging and that there is little that can be done. But today I want to tell you something important. You do not have to resign yourself to this. That constant phlegm, that throat clearing that won't let you rest, usually has an underlying cause that is often overlooked, and many times it is not directly coming from the lungs. In this video, I am going to explain what that cause is, and most importantly, I will show you a clear and practical plan to help you reduce it and feel a cleaner, clearer throat again. The goal is for you to be able to speak without interruptions, live with greater peace of mind, and stop depending on solutions that only mask the problem without fixing it. I am Dr. Gabriel Mena. I am around 50 years old, and for many years I have accompanied older adults in understanding their bodies better and regaining well-being through clear, practical information that can be applied to everyday life. Welcome to my channel. Here we talk about integrative health, longevity, and natural, very simple habits that help you maintain physical, mental, and emotional balance. Take note and share this with your family and friends to help them improve their health. We upload new videos every day, so subscribe and activate the notification bell so you don't miss any updates. Before we continue, if you find this content valuable, a simple gesture like liking the video or sharing it helps this message reach more people who need it. Thank you from the bottom of my heart for being here and for taking care of your health. Now, let's get into the topic. I remember, for example, a patient my age who came in very worried because he couldn't finish a conversation without clearing his throat. He thought there was no solution. When he understood what was causing that phlegm and began making small changes, he told me something very simple but powerful. "Doctor, for the first time I feel relief in my throat." And that is exactly what I want for you. Before we go on, if this topic feels familiar to you, I invite you to subscribe to the channel so you don't miss practical and responsible advice like this. And if you feel like it, tell me in the comments where you are watching from. I like knowing that we are connected even from a distance. Now let's start with the basics. It is important that you understand what phlegm really is and why your body produces it. I suggest something. For a moment, don't see it as an enemy, but as a signal. Phlegm is mucus, and mucus plays an essential protective role in your body. Imagine your airways as delicate tissue covered by a thin layer of mucus. That layer acts as a protective barrier. The air you breathe, even when it seems clean, contains dust, pollen, viruses, and bacteria. The mucus traps all of that before it can cause harm. For this system to work properly, the body relies on tiny structures called cilia. They are like millions of little brooms that push the mucus toward the throat. Once there, you swallow it almost without noticing, and in the stomach the acids take care of neutralizing everything. When this process is in balance, you are not even aware that it is happening. The problem appears when that balance is disrupted, when the body produces too much mucus or when it becomes thick and difficult to move. It is like a traffic jam. Too many vehicles or very slow ones block the road. That jam is what you feel as accumulated phlegm, that congestion that makes you cough in an attempt to clear the way. And although it is true that the body changes with age, that does not mean you have to accept this discomfort as inevitable. Understanding what is happening is the first step toward fixing it. If you feel that the phlegm does not go away and becomes thicker and more uncomfortable each day, it is important for you to know that this does not happen by chance. With age, the body changes, and in older adults it is common for the mucous membranes to dry out more easily. The cough reflex becomes weaker and, very importantly, the sensation of thirst often decreases. All of this can lead to mild but constant dehydration, which makes mucus thicker and harder to eliminate. That is why, as we will see, maintaining good hydration is one of the key factors. I want you to keep this idea in mind. Persistent phlegm is not a sentence of aging. It is a sign that something in the body is out of balance. And our goal today is to identify those causes so that balance can be restored. Now let's get to the heart of the matter. Over the years, in my practice, I have identified 5 causes that appear again and again in people with constant phlegm and that, unfortunately, often go unnoticed. Pay close attention, because it is very likely that you will recognize yourself in one of them. The first is what I call the silent enemy, laryngopharyngeal reflux, also known as silent reflux. When we hear the word reflux, almost all of us think of heartburn or a burning sensation in the chest. But this type of reflux is different. It is deceptive, because many times it does not produce any sensation of acidity. Its area of impact is not the chest, but the throat and the larynx. Let me explain it simply. Between the esophagus and the stomach there is a valve whose function is to prevent acidic stomach contents from rising. Over time, or due to certain habits, that valve can weaken. In silent reflux, it is not usually a stream of acid that rises, but acidic vapors accompanied by digestive enzymes. These vapors reach a very delicate area, the throat, which is not designed to withstand that type of aggression. How does the body respond? By defending itself. And what is its main defense mechanism? Producing a thicker, stickier layer of mucus to protect the tissues. That layer is precisely the phlegm you feel. This is not a cold or an infection. It is your throat trying to protect itself from acid coming up from the stomach. I clearly remember the case of Mr. Hector, a 78-year-old patient I saw some time ago. He had been dealing with constant throat clearing and a very hoarse voice upon waking for more than a year. He had seen several specialists, and they kept telling him it was normal for his age. When I spoke with him calmly, the typical signs of silent reflux became clear: morning hoarseness, a constant need to clear his throat, and an uncomfortable lump-like sensation. He had never experienced heartburn. We worked on simple changes in his diet and daily habits, focused on controlling that reflux. Within a few weeks, the phlegm that had caused him so much distress began to decrease noticeably. That relief is possible when the correct cause is identified. The most common symptoms of silent reflux are the constant need to clear the throat, a hoarse voice, especially upon waking, a dry, persistent cough that worsens when lying down, the sensation of something stuck in the throat, a bad taste in the mouth upon waking, and in some cases, difficulty swallowing. If you identify with several of these signs, it is very likely that this is one of the reasons behind your persistent phlegm. The second cause is what I call the drip you don't see, chronic postnasal drip. This is a constant flow of mucus from the back of the nose down into the throat, often without the person clearly noticing it, but which ends up accumulating and creating that uncomfortable sensation that simply will not leave you alone. If you feel that phlegm gives you no relief and you have that constant discomfort in your throat, today we are going to close this topic by giving you clear and practical solutions so you can start noticing real relief. The goal is for you to understand what is happening in your body and, above all, what you can start doing today to reduce that excess mucus and regain the feeling of a clean, clear throat. Imagine that there is a faucet in your throat that drips non-stop, day and night. That constant dripping irritates the pharynx and creates the ongoing sensation of having something you need to swallow or clear away. Unlike a common cold, this problem can be very subtle. You may not even have a blocked nose. In many cases, the only sign is that phlegm that seems to never disappear. Where does that dripping come from? One very common cause is allergies, and not just seasonal ones. Many people develop sensitivity to allergens found inside the home, such as dust mites, mold, or pet dander. This keeps the nasal passages inflamed and produces constant mucus. There is also non-allergic rhinitis, in which the nose produces mucus in response to temperature changes, very dry air, or irritants like smoke or strong perfumes. And we cannot forget chronic sinusitis, where inflamed sinuses allow mucus to drain down into the throat. If you notice that your phlegm is accompanied by sneezing, nasal itching, or gets worse in certain places, it is very likely that postnasal drip is behind the problem. Another very common and often overlooked cause is dryness, whether from dehydration or dry environments. The texture of mucus depends directly on the amount of water in your body. Mucus is mostly water, When you do not drink enough, the body reuses fluids wherever it can, including from mucus. The result is thick, sticky mucus that is difficult to clear. It is not that you are producing more phlegm, but rather that it becomes so dense that it gets trapped in the throat. This is especially important in older adults, because the sensation of thirst decreases with age. In addition, some medications, such as diuretics, cause you to lose more fluids. On top of that, heating in winter and air conditioning in summer dry out the air and, with it, the mucous membranes. If you drink little water or your urine is usually dark, it is very likely that dehydration is making your phlegm worse. There is another cause that deserves our full attention: chronic bronchitis and COPD. Here we are talking about a serious condition. Chronic obstructive pulmonary disease, which includes chronic bronchitis, produces a significant excess of phlegm. Its main cause is smoking, even in people who quit years ago. In these cases, the airways remain inflamed and the glands produce excessive thick mucus. This is the classic cough with phlegm, very common in the morning. Unlike other causes, here the phlegm originates deep in the lungs and is often yellow or greenish. If you have smoked and have a chronic cough with phlegm and a feeling of shortness of breath, it is essential to see a doctor as soon as possible. We also need to take a look at the medicine cabinet. Many older adults take several medications, and some can cause persistent phlegm as a side effect. A classic example is certain blood pressure medications, especially those that end in pril, which can cause a dry, irritating cough and create the sensation of phlegm. Other medications, such as some antihistamines, dry out the mucous membranes and make mucus thicker. Never stop a medication on your own. The key is to observe. If your problem started shortly after beginning a new treatment, talk to your doctor about it. In many cases, there are alternatives. Now that you know the causes, let's move on to what matters most: how to solve the problem at its root. This is not about temporary fixes, but about a comprehensive approach. The first step is smart hydration, a simple yet powerful tool. In general, it is recommended to drink between 1.5 and 2 liters of fluids per day. A practical guideline is to multiply your weight in kilograms by 35 to estimate how many milliliters you need. But there is a key detail: temperature. Warm beverages work much better than cold ones to combat phlegm. Heat helps thin mucus, and steam soothes the airways. Start your day with warm water and lemon, have an herbal tea mid-morning, include broths with your meals, and enjoy an infusion in the afternoon. Ginger tea with lemon is excellent for its anti-inflammatory effect. Thyme helps expel phlegm. Mint opens the airways. Chamomile with honey soothes and softens the throat. Make it your goal to drink something warm every few hours. This simple change can make a big difference. The second step is taking care of the environment you breathe in. You can drink plenty of water, but if the air is very dry, the problem will persist. Ideally, bedroom humidity should be kept between 40 and 50%. A cool mist humidifier can be very helpful, as long as it is cleaned frequently to prevent mold and bacteria. If you do not have one, you can use alternatives such as inhaling steam from the shower before bed, doing steam inhalations with a bowl of hot water, always with caution, or even placing a damp towel in the room overnight. The third step involves natural techniques to clear and soothe the throat. Gargling with warm salt water 2 or 3 times a day helps reduce inflammation and wash away phlegm. Pure honey, taken before bedtime, creates a protective coating that calms irritation and reduces nighttime coughing. Nasal rinses with saline solution are especially helpful if there is post-nasal drip, as they clear the sinuses of mucus and allergens. Remember to always use distilled or boiled water. The fourth step is to act directly on the main cause. If you suspect silent reflux, raise the head of your bed a few inches so gravity helps prevent acid from rising. Avoid eating in the 3 hours before bedtime and reduce trigger foods such as fried foods, fats, spicy foods, chocolate, coffee, carbonated drinks, alcohol, and tomatoes. If the problem is post-nasal drip due to allergies, reduce allergens at home, use dust mite covers, wash bedding in hot water, vacuum with a HEPA filter, and try to keep pets out of the bedroom. These measures, combined, not only relieve the symptom but also correct the cause. As a physician, I want to be very clear. This guide does not replace a professional medical consultation. You should see a doctor if phlegm lasts more than a month despite applying these tips, if blood appears, if it changes to a very dark color along with fever or general discomfort, if you have difficulty breathing, chest pain, unexplained weight loss, extreme fatigue, or a bluish coloration of the lips or nails. My goal is to give you tools, not to replace your relationship with your doctor. I speak to you from my experience as Dr. Gabriel Mena. I have seen many patients identify with this problem. I remember, for example, a 72-year-old woman who had been clearing her throat nonstop for months. She thought it was normal for her age. With small changes in hydration and environment, within a few weeks she told me she felt her throat clear again. Stories like this remind me that improvement is possible. Today you have learned that persistent phlegm is not simply a matter of age, but a sign that something can be adjusted. You have a practical method in your hands to start changing how you feel. Do not resign yourself. Choose one step, the simplest one for you, and start today. If this content has helped you, I warmly invite you to subscribe to the channel, activate the notification bell so you do not miss any of our daily videos, and share this message with someone who may also need it. Tell me in the comments which tip you are going to put into practice first. Reading you brings us together and strengthens this community. And before we say goodbye, I invite you to pause and thank God for life, for the body we have, and for the opportunity to learn and take better care of ourselves every day. Here on Dr. Gabriel Mena's channel, we are very happy to contribute to your health and to the improvement of your habits. Tomorrow there will be a new video, prepared with you in mind. I look forward to seeing you. Take good care.